Okay, we're going to talk about back pain and neck pain and spinal degeneration, really degenerative disc disease. We'll talk about DISH, which means diffuse idiopathic skeletal hyperostosis, as well as the things that go with it, OPLL, ossification of the posterior longitudinal ligament. And just for background, one of the main things I do is work as a neuroradiologist. I've looked at many thousands of spines. I used to run a spinal injection clinic. I even did acupuncture, epidural steroids, foraminal nerve blocks, all this stuff. So anyways, this first picture shows us the anatomy of the spine. And what one can see is the abdominal aorta runs right in front of the lumbar spine. It gives off a branch to the spine called the lumbar artery. And then a small twig from the lumbar artery goes up to the upper end plate and down to the lower end plate. The disc itself has no blood vessels, but the disc is alive. The disc runs on anaerobic glycolysis, and it gets its nutrients, its glucose, by diffusion from the end plate. The end plate is just the bottom and the top of the vertebral body. And it then expels its waste products also through diffusion that then goes into the end plate and is taken up by the blood vessels of the end plate. So one can see that the end plate itself, by the way, has relatively poor blood vessels. It's really a growth plate equivalent out of cartilaginous bone, like you see at the end of a long bone. The growth plates, epiphyseal plates. And it's like endocrinal ossification of that bone. Cartilage-related bone doesn't have as good a blood supply. So even under optimal conditions, end plate blood supply is not that great. When you superimpose upon that atherosclerosis from a high-fat diet, diabetes, vasoconstriction from sodium and whatnot, you're talking about rather poor blood supply to the end plate, which then means poor blood supply to the disc, and the disc will start to fail. That's by far the most common cause of back pain and degeneration of the spine. I see this all day long every day, thousands and thousands of cases. This is nonstop. You can basically point to some guy in the street, he's over 50, he's walking a little hunched over, he's got degenerative disc disease of the spine. Okay, some important definitions for talking about these spine disease. Two vertebral bodies and the disc in between is called a spinal segment. We're going to refer to that a lot. The blue, of course, is the discs, and the sacrum has got a bit of a triangular conical shape. Okay, so some of the key points in this talk. Everybody knows that heart disease means a lack of blood flow to the heart because you've got atherosclerosis in the coronary arteries. That's the most common cause of death in America. And a lot of people know that it's the same disease most of the time that causes impotence in men. And impotence in men, super common. Remember the rule of decades? 40% at 40, 50% at 50, 60% at 60, 70% at 70. Okay, well, brain doctors, the ones that are really good, they know that most of the reason people become demented is because of lack of blood supply to the brain. Yeah, sure, there's all this other stuff about oxidative stress and beta amyloid and all that, but you know what? I look at brains all day long. It's mostly because they got atherosclerosis to the blood vessels in the brain or supplying the brain. All right, but now we're getting into more rare territory, things that very few people know, including very few doctors know. Most of the reason people go blind, it's still atherosclerosis or hypertension or diabetes. These are all forms of vascular disease. And it's the same reason why people have hearing loss. These things are uncommon in countries where they don't eat the standard American diet, all this fat and whatnot. And here's something almost no one knows, is that most back pain is also caused due to atherosclerosis of the artery supplying the spine. And you would think, it's the same problem everywhere. Atherosclerosis is a systemic disease. It affects every artery in your brain. And that's why I'm saying is if you got atherosclerosis in one spot, it doesn't just mean you've got one blockage in an artery in your heart. It means that you have atherosclerosis everywhere in your body, every single artery in your body, including your brain. And so you really want to try to minimize the risk factors, minimize progression of it, and reverse it to the extent that you can, because it just causes progressive destruction of your tissue and accelerated aging. And the good news is it's pretty easy to prevent it and reverse it. You just have to know what to do. Okay, so standard American diet, the usual meat, dairy, oils, processed food. And another thing I would point out to you is I look at CAT scans all the time of the head, the neck, the chest, the abdomen, the spine. And what you see in older people in this country is everything is all calcified. It's pretty routine that I see diffuse extensive calcification of the thoracic aorta, the abdominal aorta, the coronaries, and then this gets into other arteries too, the arteries to the brain, the carotids, arteries to the Johnson, the pudendals. When I look at brain CT scans of the brain, I see calcifications in the basal ganglia, the motor centers of the brain. I see them in the choroid plexus, part of the blood-brain barrier filtration system. I see them in the hippocampus memory center of the brain. I see them throughout the spine. That's what we're going to talk about. That's what all this DISH OPLL stuff is calcifications and bridging osteophytes, bone spurs in the spine. And what I'm getting at, you remember the Greek mythology, Medusa, who could turn people to stone with one look from her? And what I'm trying to say is that's what atherosclerosis does in the human body. It destroys tissue, calcifies it, and moves on to another spot. And I think a big part, and also, when do I see this? People start falling apart after 40 years of age. I say that because if I look at an x-ray of the spine, a 20-year-old guy and a 35-year-old guy, their spinal x-ray is probably going to look the same. But after 40, somebody's got bad habits. You know, they're fat, they smoke, they're alcoholic, they're diabetic or something. I'll start seeing multiple areas of degeneration in their spine. They're starting to develop irreversible disease, and that's kind of my point. Before 35 years of age, everybody looks good. After 35, your habits determine the rate at which you decline. And if you really exercise a lot and you're real healthy, you can even improve and maintain that for a long time. It's interesting. I just read the book Proteinaholic again for like the third time by Garth Davis. It's a good book. And the reason I mentioned it is he was a guy who started out being like one of the Pima, you know, fat and sick. And then he changed his diet, started exercising, and he became like a Tarahumara. So I'll give him credit for that. It's a very good book. All right. When patients have back pain or neck pain, they often go to a doctor to get an MRI. I'm going to talk a little bit about the terminology on an MRI so you'll be able to make sense of all that. They're often getting pain meds, steroid injections, or surgery. And there's a role for all that stuff. Some of the times that can help a lot. It can cool things off till the body starts to recover. But what I'm also saying here is I see lots of fat people and lots of sick people, lots of people with back pain, and they've got this obsessive attitude, I just need to get surgery. I just need to get surgery. And what I'm trying to say is, unless you improve the blood flow to your spine is screwed, okay? It cannot heal and it cannot improve unless you improve the blood flow. Surgery can help. Steroids, you know, epidural steroids, stuff that can temporize the pain for a while and you know, get your mind off the pain and let the body heal. But you got to do your role as the individual to improve blood supply to the spine, and that comes from diet and lifestyle. And exercise really helps a lot too. We're going to talk about that in just a sec. And the smart thing to do is just learn how to avoid all this stuff. Okay, getting back to this, again, the abdominal aorta is right here, and you'll form atherosclerosis on the posterior wall of this aorta. And then that will start to stenose and block the lumbar artery, which just means decreased blood supply to the vertebral body, and especially these end plates. And then the disc gets decreased blood supply, and it starts to fail. Another reason why you want to walk a lot is walking increases nitric oxide in the muscles around the spine and within the vertebral bodies, and it gets more blood supply to the bones and to the disc. It has a milking action as the bones and the disc move relative to each other to get the nutrients in and get the waste products out of the disc. So walking is very good for the spine, because people sometimes say, oh, your back hurts, you should just, you know, stay in bed all day. No, you got to keep moving. Moving is a big sign of life, and it gets blood flow to the spine. Sometimes you might have to lay down for a little while, but keep moving. That'll get more blood supply to the spine for all this chronic back pain stuff. When the disc starts to fail, what happens is you get cracks in the outer layer of this. We'll see a better picture of it in a moment, but the outer layer of the disc is called the annulus fibrosus. The center is called the nucleus pulposus. And the annulus fibrosus around the periphery, it's like a steel-belted radial tire, and it keeps the soft jelly donut, like a filled jelly donut, in place. And that's for supporting compressive force, for, you know, moving and for carrying your body weight around or carrying an object around. But when that disc becomes ischemic, annulus fibrosis fails, and then the nucleus pulposus starts to leak in all directions and eventually becomes dried out, and it can no longer do its job so well. Okay, and then the spine's got lots of proprioceptors. It senses the abnormal motion, and then the spine takes actions to compensate for that, which we'll see. Leads to what I would call spine failure. Okay, a couple points about the physiology of a disc. First of all, we talked about the upper and lower end plates having poor blood supply because they're growth plate equivalents, cartilaginous bone, endocrinal ossification, and all that. Then we talked about the disc having no blood vessels functioning based on diffusion from the end plates, running on anaerobic glycolysis. The disc is alive. It's got hydrated glycosaminoglycan, simply meaning that it gives it much more ability to resist compressive loading, weight bearing, and movement compared to a dried out disc. That's why a young guy is stronger. He's got a healthy spine, healthy discs, okay, healthy core. All right, abdominal aortic atherosclerosis is worse on the posterior surface, blocks up those lumbar arteries. Once they're blocked, you get drop in blood supply to the spine. End plate ischemia, that's also the spot where you'll see infections begin in that end plate because it has poor blood flow. and you'll start getting erosions into it, disc herniations into it, called Smorl's nodes. It's the lack of blood supply. Ischemia just means lack of blood supply, super common word in medicine, and that causes failure of the annulus fibrosus. And then the disc also starts to lose height. When the disc loses height, that means the foramen loses height. The foramen is what the nerve exits through, so that can also compress the nerve and cause pain. When the disc fails, the annulus fibrosus fails posteriorly, you can get a herniation of the disc, and that disc herniates. It can then push on the dural sac, which surrounds the nerve roots, or a nerve root itself. The disc is innervated too. Just a crack in the disc can be painful because there's a sinovertebral nerve that goes to the disc. Okay, so here's a picture now showing the orange stuff just was there to indicate the cartilaginous origin of the upper end plate and the lower end plate. Okay, and that's why they have poor blood supply. The center of the vertebral body has good blood supply, relatively speaking. Okay, a tear in the posterior part of the disc is called an annular fissure or an annular tear. Fissure is kind of the newer, more modern word. It's less sort of inflammatory and excitatory. Like tear is, you know, people worry about, does that mean that something happened or just cracked, all right? Anyways, we'll see these on MRI. They'll be high signal, hyperintense on T2 sequences. This is a typical sagittal MRI appearance of the spine. Here's the nucleus pulposus in the center. That's what we meant by a jelly donut filling in the center. And then these concentric fibers going around the outer part of the disc are called the annulus fibrosus. And they're like a steel-belted radial tire to keep the nucleus pulposus, the softer material, in place. When you get a crack in the annulus fibrosus, nucleus pulposus starts to leak posteriorly, and it can start bulging out, kind of like squeezing toothpaste out of a tube, and press on things, nerve roots and the dural sac, and cause pain. Here over here is showing, see how big these discs are in their vertical height, whereas this one has a diminished vertical height. That's a typical degenerative disc. And it'll start out at one level, and because the disc has failed at one level, there'll be abnormal motion. That's going to generate a bone-forming response. But the second thing that happens is, because there's a lack of ability to support weight, the adjacent disc now has to bear more weight, and that increases the speed at which it fails. Okay, so you get accelerated adjacent segment degeneration once you have any initial site of degeneration. That's why these processes can become accelerated and get worse and worse. Okay, let's just real quick talk about what can treatment do. A person can take pain medicines that'll take the edge off the pain for a while. They can take steroids that'll decrease the inflammation and the pain. They can have a steroid injection, again, to cool off the pain for a while. For some of them, they're really in a lot of pain, and it's hard to walk or do anything. However, again, if you want things to heal and rapidly improve, you got to improve blood supply. Surgery can decompress things. Sometimes, especially in the cervical spine, I'll see compression of the spinal cord. It's uncommon, but it does happen, and surgery is very helpful in that situation. Patient could end up quadriplegic if they don't. Surgery can also fuse the segment. If there's abnormal motion of the vertebral body relative to each other, surgery can put a posterior pedicle screw in there and fuse it. They can also fuse a segment through the vertebral body, put something in the disc space, and that's called an interbody fusion, for example. Not uncommonly in the cervical spine, you see your ACDF, anterior cervical discectomy and fusion. And they can restore height to the disc space. That'll increase the height of the foramen, and that sometimes can be helpful. Okay, but the point I'm making, like with the big lesson to learn from this, just like everything else in your body depends on blood flow, your spine depends on blood flow. You want to have a nice, happy life with a strong back, a strong backbone, maintain good blood supply. Poor blood flow leads to progressive degenerative disc disease. It's often abbreviated DDD. Okay, so now we're getting to bony compensation and what the spine does. When these discs fail, see how they've got diminished height in this picture at all these levels? This is multi-level degenerative disc disease, and there's going to be abnormal motion of these vertebrae relative to each other because the disc cannot hold them in place. It cannot do its job. Normally, there's something called Sharpie fibers that attach the disc to the vertebral bodies and prevent abnormal motion. And you got to remember, the spine is real important. It protects your central nervous system. So it's got lots of proprioceptors to sense abnormal motion. And so when it senses abnormal motion, it says, emergency over here, start laying down calcification. So it lays down calcification, and it produces these giant bone spurs. Bone spurs are called osteophytes. That's the radiology term for them. And then the other term is DISH. DISH means Diffuse Idiopathic Skeletal Hyperostosis. You'll also see DISH in some books referred to as Forestier's disease, but we always call it all day long, we call it DISH. Okay, so what happens is initially one level will fail, and then the osteophyte will form. Another level will fail, osteophyte will form. And this process will work its way all the way up to the top of the spine, all the way up to the skull base, okay? And how common is this? I see this all day long, every day. It's so common, it's not even funny. And I can also tell you, well, can you look this up in the standard textbooks? Let me tell you something about the standard textbook of spine. They stink, okay? They're so far out of date. You'll see things in there that are comical. Oh, that dish is a rare condition, or you hear like OPLL is something more often found in people of Asian descent. Yeah, BS. I see it all day long, every day. All right, so anyways, and it's easy to explain all this stuff from a traction mechanism. So the mechanism is the disc fails, abnormal motion, and then the spine fixes itself by fusing the segment with an anterior bridging osteophyte. We're going to later learn about sometimes it'll fuse it with a posterior osteophyte as well. And so you want to improve blood supply, the sooner the better, because this process is going to march its way all the way up to your skull, and your entire spine will be fused and stiff. Okay, you don't want that. Okay, so like I was saying, DISH is super common. It's an increased association with obesity, diabetes, hypertension, high-fat diet. And they've done research on graveyards, and what they found in Europe, they had to dig up a bunch of graveyards for construction purposes. And so they looked at the bodies, and in the bodies where aristocrats were buried, rich people who could, afford to eat meat on a routine basis, drink beer in large quantities on a daily basis, they had tons of DISH, all right? But then where the poor people are, the peasants, eating turnips and stuff, almost hardly any DISH. And they've repeated that experience, not only in the graveyards of Europe, they've repeated that experiment with mummies, found the same thing. And they've also repeated it with indigenous populations from North America and stuff, they find the same thing. So basically, people eating a rich diet, fat people, they got a lot more DISH. Other persons, not so much. Okay, then we're going to talk about ossification of the posterior longitudinal ligament. It'll make more sense once you see a picture of it. DISH is associated with interbody fusion. So interbody fusion just means fusion between the vertebral bodies. The vertebral bodies are called the bodies sometime in the spine. DISH leads to autofusion of the entire spine. So it just begins at one level in the lumbar spine, and it'll work its way up entire spine. And, I had seen articles and heard people mention the ischemic causative component of lumbar spine DISH, but I figured out it's everything. It's not that lumbar spine ischemic disease isn't just the beginning of a little bit of degenerative disc disease. It's the beginning of all degenerative disc disease in the spine, and it also can easily explain OPLL in the cervical spine. When we look at a picture, it'll make more sense. And basically, the entire spine fuses from top to bottom, and the person's all stiff. This is a typical old guy walking around with a cane or a walker, and then he asks his doctor, oh, can I please get a motor scooter? And they give him a motor scooter, and then he's dead in 6 months, okay? People need to walk around and move, okay? That's a very bad sign if a person's back hurts so much and they're so stiff and weak, they no longer walk. You got to move to get your lymphatic flow. That flow of the lymphatic material, the chyle, that's all part of good health. We're made to walk around all day looking for food and extended family groups and whatnot, all right? That's what we're made for. We're not made for this modern stuff, eating fat all day and sitting in a chair watching TV or something. Okay, once the spine's all stiff and fused, like a normal young person, if you fall down, you put your hands out, you catch yourself, it's a little bit embarrassing, but you're okay. When some of these old people fall with these stiff autofused spines, they have fracture, their spine snaps like a piece of chalk. That's what those fractures are called in the spine. You can see plenty of scientific articles on that. Chalk stick fractures in DISH patients, okay? Ankylosing spondylitis is very similar. It's almost the same thing. I actually believe there's a second type of ankylosing spondylitis. You'll hear about ankylosing spondylitis as an autoimmune disease in young adults, especially men, so-called HLA B27, MHC type disease. But you know what? I see it in old people all day long, every day. The equivalent findings virtually, okay? Maybe not quite as extensive, but essentially about the same thing. And it's just from ischemia and degenerative disc disease and a high-fat diet. Okay, let's see. So that's the money on that. All right, so now here's getting into the more advanced stuff. All right, so when the spine fails at one level, as we spoke about, then it'll form the DISH osteophyte, then it'll fail at the next level, DISH osteophyte, and this process will work its way all up and down the spine, all the way to the top of the spine at the skull. In addition, you can see this abdominal aorta has all these big calcifications on the posterior wall. That's from atherosclerosis, and it goes all the way up and down the spine. And it's really a destructive process because you lose all the elastic fibers, which means you have a diminished ability to produce diastolic flow. So during contraction of the heart, that's called systole, the aorta expands outward. During diastole, relaxation phase of the heart, the aorta has elastic fibers that have elastic recoil, and those propel blood flow during diastole, the relaxation phase of the heart. Contractility. So the aorta normally is like a second heart, especially the ascending aorta component, right where it comes off the heart. And once it's all calcified, forget about it. It doesn't have hardly any elastic ability to generate diastolic flow. And that's why a young person is going to have a narrow pulse pressure. Let's say there's something like 100/70. So that's 30 millimeters mercury difference between systole and diastole. An old person, they might have a blood pressure something like 170/100. That's a 70 millimeters mercury difference between systolic and diastolic pressures. And they just don't have much diastolic flow, which causes all kinds of problems. And you can't recreate those elastic fibers in your ascending thoracic aorta after your early 20s. So what's going to happen is, that's partly why people go down the tubes when they're 35, is when you start, like I said, almost everybody looks pretty good up to about 35, and then there's different rates of decline. And a big part of it is they've calcified their aortas, so they no longer can maintain diastolic flow. Peak systolic flow has to go up to maintain blood supply to the brain. So now they're hypertensive, high systolic pressures, damage arteries all over the place, and they get this progressive decline. Okay, so what you want to do is avoid everything that causes hypertension. Now, to explain this some more, the spine responds to the disc failure and abnormal movement, segmental instability, forming these big, bulky anterior osteophytes, and that's DISH. Then what happens is, because things aren't moving and they're static, anything in the body that no longer moves like it's supposed to will often calcify. So you get calcifications which eventually turn into bone, and they'll fuse these vertebral bodies together. So that's called interbody fusion, fusion of the bodies, the vertebral bodies, okay? And then the posterior longitudinal ligament is this big ligament that runs all along on the posterior surface of the vertebral body. So that will ossify, and that's called ossification of the posterior longitudinal ligament. It begins focally along the posterior surface of the disc. So people will often read these on an MRI. On an MRI, you can't really see the calcification. You can see it unless it's pretty bulky. You can see it obviously and easily on a CT scan. So they'll often read it as calcification of the disc. Posterior disc margin is calcified. Well, that's ossification of the posterior longitudinal ligament, and it gets progressively over time more bulky. It's much more common in the cervical spine, but I see it all the time. I see it almost every day in the lumbar spine as well. And so this is complete fusion of spine. And again, because their spine is stiff and in pain, they don't walk much, all their muscles atrophy. And then when they fall over, the spine can snap like a chalk stick. And that's a classic fracture, the chalk stick fracture. I see one of those every couple of months. That's pretty bad. I see guys go paraplegic, quadriplegic from that. Okay, here is another picture of the spine. Just a little more terminology, because you're going to hear these if you ever look at an MRI report. You want to make sense of it. Okay, Schmorl's node just means the disc can herniate into the vertebral body. A disc herniation that goes posterior but does not exceed the height or the bottom or the upper height of the disc space, that's called a protrusion, which is kind of like the fancy word for a small disc herniation, even though some protrusions can go quite far posteriorly and be big. In general, the word protrusion means small disc herniation. Here's an extrusion. So extrusion means it goes above the height of the disc space or below the height of the disc space. So you would say disc extrusion with upward extension, disc extrusion with downward extension. The implication of the word extrusion is it's a bigger disc herniation, perhaps more likely to need surgery, more likely to be the one causing the pain, more likely to be the so-called pain generator. That's a common term in spine diseases. Where is the pain generator? Meaning, what is the abnormality of the spine that's causing the pain? And it's good to find that out, because if you know what's causing the pain, you can inject epidural steroids next to that level. You can potentially do surgery at that level. But like I said too, a big secret about spine is that most of the time, there's no one single focal pain generator. The entire spine is generated from ischemia, okay? Another thing that's not widely known, but again, I see it every day, is all this fat. I put these big yellow stripes here in the spinal canal, and that is called epidural lipomatosis. So epidural is just the space around the dura. The dura is the name of the sac that encloses the nerve roots. Epi means outside of or above or around. So epidural is the fat around the dural sac with the nerve roots in it. And in some people who are fat, man, they accumulate lots of fat here, and it starts pushing on their nerve roots as they descend through the lumbar spinal canals. And it can occur also in the thoracic spine and the cervical spine, but it's more common in the lumbar, especially in the lower lumbar. And that's called epidural lipomatosis. And if a person loses weight, they can decrease some of that fat, and they'll have less compression of their nerve roots, and they'll have a decrease in their symptoms. They got a good chance to improve significantly. But that's another thing. So this fat accumulating in the spine and all the atherosclerotic stuff we talked about in degeneration of the spine. So once again, diet is a major causative factor in spine. It's the most common causative factor. Being sedentary contributes to it. Okay, real quick, how to improve blood flow. And this is in one of my books here, A Tale of Two Toes in a Hot Tub, How to Improve Blood Flow. Goes into a bunch of other stuff, a lot of jokes in that book. But the bottom line is pretty simple. Eat plants. Why? Because you eat plants, you get more potassium. Potassium is a vasodilator. What else? In the center of the chlorophyll molecule is magnesium. Magnesium is also a vasodilator. So right there, you got two vasodilators. Now, processed foods is the opposite. Processed foods full of sodium. Sodium is a vasoconstrictor, inhibits endothelial nitric oxide, so it's going to narrow your blood supply to anything. It's going to diminish your blood supply to anything. Okay, plants, eat those leafy greens. You get the nitrates from things like arugula and other salads, and those also increase blood supply. Go out in the sun. Sunshine generates a lot of nitric oxide. You got skin precursors to nitric oxide that are activated in sunshine, and that'll get your blood flowing. It also increases your vitamin D3, the active one. That's the one that really matters, is vitamin D3, the active form. The 25-hydroxy vitamin D, calcidiol, that's not as important. It's the calcitriol, the D3 vitamin that really matters. Because a lot of people have been concerned about that. And what I'm trying to say is, even if you don't have that much, we'll talk about that some other time, but get some sunshine. It's really good for your spine health as well as everything else. Plants are low fat, other than nuts, seeds, and avocados, which in my opinion, I think those impair blood flow. Best diet, also 100% plants. I recommend no meat, not one bite. Forget about meat. It's just, all it does is make you sick. Animal fat, animal protein are poisons, okay? We'll learn that in other lectures, but it's true. All right, no caffeine, no sweets is my recommendation. That's what I do. You can do what you want, but I think that's the best thing a person could do. Avoid processed food. Tons of sodium in processed food. Typical standard American diet, 80% of the sodium is coming from processed food. And, you know, our primitive ancestors probably ate about 200 milligrams a day, at the most 500 milligrams, and whereas a lot of Americans are eating 7,000 or more milligrams of sodium per day. It's not a good idea. Avoid meat. We talked about that. Animal protein, too, raises cholesterol. It's not just the fat. So even if you drank skim milk, it'll raise the cholesterol. Okay. No fish. The joke is, teach a man to avoid fish, you keep him healthy for life. No tobacco, no alcohol. I recommend no alcohol. I know some people are going to tell you have a little bit. Do what you want. I don't drink this stuff. I think it's a bad idea. No oils, no sweets. Sweets, simple sugars will raise your triglycerides, increase your blood fats, and they're atherogenic. We talked about walking a lot, increasing nitric oxide, maintaining muscle strength. Manage your stress, get your sleep, all that. Be resilient, have a purpose in your life that guides you, that helps you to have an inner strength to overcome a lot of diseases. Okay, some quick references. I wrote an entire book on this stuff. Here's one of the versions of my book. Ischemic spine, most common cause of back pain. If you're interested, it goes in a lot more detail. And then I got some other references here on all these papers and whatnot and other books. So anyways, I hope that's helpful. And whatever improves blood supply is good for the heart, good for the brain, good for the Johnson, good for the spine. So hope that helps.